Okay, it looks like we are live. Good afternoon. We are so thankful that you have joined us for the second of two special sessions, Vaccines and Your Vaccine Rights. My name is Julia Eplinzaf, and I am Outreach and Training Coordinator at Cook County's Commission on Human Rights. I have the pleasure of being here with Dr. Jacqueline Korpix, Medical Director for Cook County's COVID-19 response. Hi, Dr. Jackie, how are you? Good. I will pass it shortly, but first I'm going to discuss a bit about the COVID-19 vaccination rights for employees and employer obligations ordinance. So at the Cook County Commission on Human Rights, our mission is twofold: to protect people who live or work in Cook County from discrimination and harassment in the areas of employment, housing, public accommodations, credit transactions, and access to Cook County facilities, services, and programs, and also to ensure that those who work in and for the benefit of Cook County are paid an appropriate wage for their labors and receive appropriate benefits. As such, we are the enforcement agency for a number of laws in Cook County, such as the Human Rights Ordinance, which most recently includes the Just Housing Amendment, as well as several wage and benefit laws, such as the Minimum Wage Ordinance, the Earned Sick Leave Ordinance, the Living Wage Ordinance, and what I will discuss shortly, the COVID-19 Vaccination Rights for Employees and Employer Obligations Ordinance. Those ordinances broadly protect against discrimination and harassment in a variety of contexts. So what we do in that light is we receive and formally investigate complaints. We mediate disputes and conduct hearings. We conduct research and review policy, as well as advise Cook County President Preckwinkle and commissioners on matters involving discrimination. And lastly, we do a fair amount of outreach, such as activities like this, as well as other formal trainings, and are always willing to collaborate and work towards broad compliance for human rights in Cook County. So to talk a bit about the COVID-19 vaccination rights for employees and employer obligations ordinance, it went into effect July 1st, 2021, and includes several rights and responsibilities related to receiving the COVID-19 vaccine. The purpose, as is expressed within the ordinance, is to protect and promote public safety, health, and welfare of citizens, to establish the rights of employees to be vaccinated against COVID-19, and the obligations of employers to not retaliate against employees for exercising their right to be vaccinated against COVID-19. So, as such, employees have a number of rights that are outlined in the ordinance, including that employers may not require you to get vaccinated outside of your working hours. You can schedule your vaccine appointments during your shift. If your employer requires you to be vaccinated and your appointment is during your shift, you are to be compensated up to 4 hours per dose at your regular rate, and you are not required to use paid sick leave or paid time off to get vaccinated. Also, if your employer does not require the vaccine, you can use paid sick leave or paid time off to receive the vaccine. Additionally, an employer may not require you to find someone to cover your shift during the time period that you're being vaccinated. And importantly, employers may not take adverse action such as firing, demoting, or retaliating against you for taking time off to get vaccinated. There are also described employer obligations within the ordinance. So what is an employer? An employer is any person employing one or more employees who is also doing business within Cook County. This does not apply to any wholly owned government entity. So for employers, employees can legally get vaccinated against COVID-19 during their shift, and they are not required to find someone to cover their shift to receive the vaccine. If the COVID-19 vaccine is mandatory for employment, employees are not required to use paid sick leave or paid time off, and as I previously mentioned, should be compensated up to 4 hours at their regular rate per dose. And if the vaccine is not mandatory, employees may use sick leave or paid time off to receive the vaccine. Lastly, we like to emphasize that employers are prohibited from discriminating or taking adverse action against any employee for exercising these COVID-19 vaccination rights. If you feel that your employer has violated this policy, or if you're an employer who has questions about this ordinance, we would like to stress that you can certainly and please do contact us at the Cook County Commission on Human Rights. On this screen right now is our email, our phone, and you can also find us on Cook County's website by searching for the Commission on Human Rights. If you would like to file a formal complaint, you can do so within 180 days after the date that a violation of the ordinance is alleged to have been committed, or after the complainant learns of the violation. And additional information, as well as the form, the initial complaint form, is on Cook County's Earned Sick Leave Ordinance and COVID-19 page. Penalties for violating the provisions outlined in this ordinance can result in legal fees, costs, and fines up to $500 per violation. And also whistleblower protections apply, which means you are protected from retaliation for reporting issues related to this ordinance. You can file a complaint without fear of retaliation. And then lastly, I'm going to just talk about a few questions that we have received related to this ordinance. The first of which is, what if I experience retaliation by my employer for trying to receive the vaccine and I work in the city of Chicago, or for an employer that's located in the city of Chicago? And we like to share that the city of Chicago has a separate vaccine anti-retaliation ordinance, also that is on their website, and it is enforced by the Business Affairs and Consumer Protection Department. It has similar provisions to Cook County's ordinance in that it prohibits employers from retaliating against employees for taking time to get their COVID-19 vaccine. And if you would like to learn more about that ordinance or file a complaint with in the city of Chicago, you can call 311, use the Try 311 portal, or fill out the complaint form located on their website. An additional question that we receive is, what if I don't have remaining sick time or PTO? Can I still receive the vaccine? And the answer is certainly yes. The Cook County's ordinance prohibits retaliation by your employer against you receiving the vaccine. It might be of note that unless the vaccine is expressly required by your employer, you will likely not be compensated for the time that you take during your shift to receive the vaccine. And then the last question we often receive is, I'm a part-time employee. Does the ordinance apply to me? And the answer is yes. Part-time workers that have worked at least 2 hours during any 2-week period should be accruing earned sick leave, meaning that you're allowed to use that sick leave or any personal time off to receive the vaccine. Also, if your employer requires you to be vaccinated, you should also be receiving up to 4 paid hours per dose to receive the vaccine. And that is all that I have to cover. And with that, I'm going to pass it over.
Thank you, Julia. Let me just pull up my slides real quick. All right. So as mentioned, I'm Dr. Korpix. I am a pediatrician and one of the medical directors at the Cook County Department of Public Health. I just want to cover a few vaccination updates and cover some information about how you can go and get vaccinated if you haven't been already. So the most recent update was that boosters are approved now for people who received Pfizer, Moderna, or Johnson and Johnson. And so for individuals who received Pfizer or Moderna, you are now eligible for a booster shot if it's been at least 6 months or more after your initial series, and you should be either 65 years and older, 18 plus, and live in a long-term care setting, 18 plus or have underlying medical conditions, or 18 plus and work or live in a high-risk setting. And for those people who got the Johnson & Johnson vaccine, a booster is recommended if it's been at least 2 months since that first shot. And all the shots are the same as the first and second dose, and the first dose for Johnson and Johnson, except for the Moderna booster, which is just half the dose of the first and second. So most providers, if should be offering booster shots at this time, as long as they have Pfizer, Moderna, and Johnson and Johnson on hand. Mixing and matching was also approved. Per the CDC, an individual can decide which booster shot they would like to receive, whether it be Moderna, Johnson and Johnson, or Pfizer, as long as they meet the eligibility requirements that I just stated. All types of boosters are considered to be effective, and so individuals can discuss with their doctor, healthcare provider, which one uh, they should receive if they can't make the decision on their own. Youth vaccination, we're expecting approval officially for children aged 5 to 11 very soon. So the FDA panel voted to give emergency use authorization. And so we await uh, that official EUA as well as the CDC to meet officially next week, and waiting for those new vials to be shipped. So what we're hearing is that the absolute first day that shots can go into arms, depending on if providers have the vaccine in hand and have done all the training requirements needed, would be November 4th. So we're pretty excited about that. We will be hosting many school clinics. We're working to get more pediatricians to be offering the vaccine in their offices and doing a lot of youth-centered outreach. And so with this new approval, that would make over 93% of our jurisdiction eligible for vaccine, which is really exciting. And then we await the studies for children 6 months and older, and we're hoping that those data and results will be available by the end of the year. And now I'll just go through our general information about how you can go and get your vaccine. So, in general, if you go to our website uh, or call our hotline, you will be connected to the vaccine clinic that is nearest you and most convenient. In addition, if you call the hotline, you'll be able to take advantage of our free transportation program to and from your chosen vaccine site. So this is our website and hotline information. Uh, Work sites can also request mobile vaccination teams to come on site. So you just go to that same website and click the top right corner, or you can go to the other link posted here, and then we will make sure that a mobile vaccination team comes to your work site. And we go to other organizations as well, like I mentioned, schools and senior living facilities also. This is just some more information about our mobile vaccination clinics. This is our calendar of events. So in addition to our normal Cook County health sites, our hospitals that we work with, pediatrician offices that we work with, uh, we have a bunch of mobile events going on at all times. And so we encourage you to look at this calendar to see if there's any events near you. We also have an in-home vaccination program where we send vaccinators to individuals' homes. And this is just more information about our free transportation program. Like I said, just call the hotline. I also encourage you to look at our educational resources available on our cookcountypublichealth.org website, as well as the My Shot campaign. You can print out resources and have them available at your work site, and also encourage you to check out some of our videos that we have available. So thank you so much. I really appreciate everyone who joined this session, and thank you to Julia. And we look forward to talking with you again soon.
Yes, thank you so much.